Good afternoon, it's Mark Larson to give you our COVID-19 update. So lots of good news. We now have gone 2 days without any cases. So today and yesterday, and the day before we only had one. So that's really good news for us as we move forward to phase 3. We've cleared more people to go back to work, and things are looking really good from a disease standpoint. I'm going to talk at the end about where we're at in regards to that, but we will have our request to Secretary of State Wiesman on the 17th, so we'll have it ready to go on that day. I can't guarantee you how quickly the turnover will be in regards to that, because lots of people are now moving phases. So some trying to move from phase 1 to phase 1.5, some people trying to move from 1 to 2, 2 to 3, and so we'll be ready for that. So let's just go to questions.
We only have one question today, and it is, when will restrictions lift for the assisted living facilities? What is the process for things opening up so the residents can leave and visit with family?
Yeah, that's similar to a question we answered the other day, but it's a great question. So a lot of it has to do with risk and has to do with testing. So you've probably heard that we have been instructed that all nursing homes have to be tested, and then subsequently all assisted living facilities, long-term care, memory care, adult family homes, they will all need to be tested, and all the staff will need to be tested. That's a point prevalence, so that's a one moment in time, how much disease is there. Our particular facility, Prestige, which is our one nursing home, has to have that testing done June 12th. So then the state's sending them the testing supplies, they're sending them the personal protective equipment, and then they'll do that testing. It'll go to the lab. A couple days later, we'll have a pretty good idea of how much disease we have. Subsequent to that, then we will need to look at how much that disease is going to have an impact on facilities. So obviously, we have not had any outbreaks in our facilities in Kittitas County, but Yakima has had a lot of outbreaks in Yakima County in their long-term care facilities. So I would expect, like everything else, that the long-term care facilities will not open all at the same time. So in a low incidence or a low prevalence place like us, it will most likely be that they will open sooner. That control is by the state, so the state will determine when those things can be open. And I know it's been hard for those residents in the nursing homes, it's been hard for the people that work in the nursing homes, but we realize that they're at high risk. So it's probably still a little ways down, but it's very exciting. We're going to get that testing done, and that is in the next, we should have those results in a couple of weeks. So that's the end of the questions today. I am going to talk a little bit about phase 2. So we're still in phase 2. Guidance is changing all the time. So one good thing, library opening guidance came today. So that guidance says they can do online ordering and curbside pickup. So Josephine, who is the director of the library, put something out to me saying, we're going to be open Monday through Friday to do this. So that's really good news. So people are really reaching out and starting to do things. I've been talking to this Ellensburg School, the superintendent Ginger Haberer, about how we're going to do sports in the fall, how we could possibly do sports in the fall, how we could do camps, for example. Talking with Central in regards to how they're going to do their athletics in the fall and how they're going to do students in the fall. In phase 2, there's still a lot of restrictions, and we need to pay attention to those restrictions, because if we don't pay attention to those restrictions, then we're not going to be able to move into phase 3, and we're going to be stuck into phase 2 because we're going to have more disease. So we are ready in public health to do that disease follow-up. That's part of what we need to show, but we also need to show that we have minimal disease, and that depends upon you as individuals. So wear a mask when you're within 6 feet of someone else. Stay at home, stay within your bubble. You still have only 5 people per week that you can be hanging out with. There are some other things that are, another good thing that changed is drive-in theaters. So drive-in theaters now are open. I asked the governor's office today whether drive-in theaters, whether that applied to just professional drive-in theaters or whether we could do, Young Life could have their movie theater running, and I would expect that to be back today, and answer that back today. So things are happening that are good things. They're being done safe. We shouldn't be out having big parties, so no big groups of people. Again, less than 5 people per week. Gyms are not open yet, so if you go to a gym and they're open and it doesn't seem safe to you, then you should turn around and go out. Same with a restaurant. If you go into a restaurant and you say, this doesn't feel quite right to me, go ahead and leave. You can ask businesses to mask. Hairdressers are open. They're doing a really good job of protecting you. They're wearing masks. They're asking you to wear a mask. So those are the things that I'm asking, because if our disease stays low, because we as a community have done the right things, then we'll be able to move forward into phase 3. If we go out and we do all these things that are not safe and it spread a lot of disease, then along with the increased people in the hospital and the deaths that could occur with that, we will end up stuck in phase 2 for a long time. And if you want an example of that, please look at the disease burden in Yakima, because they are hurting really big time. They've had a lot of people that are essential workers that have been out working, and their numbers are going to pass King County. So they're going to be stuck in phase 1 for a long time. So it can happen. We can do a good job and we can move into phase 3, but it really depends on you. So I hope tomorrow I can tell you again, 0 new cases, but we'll just have to see. Have a good afternoon. Thanks.